everybody, Dr. Dusty here. Today I'm going to go over some more information with you in regards to chiropractic care and your shoulder. So there's a condition of the shoulder called frozen shoulder, also known as adhesive capsulitis. And it's where the shoulder joint actually gets inflamed, it develops scar tissue, and it develops a situation where you can't move your arm. So they call it frozen shoulder. Now, in the literature, it really talks about this joint being the only involved joint in frozen shoulder, and again, called adhesive capsulitis. But really, what I see in my office, it's more of a frozen shoulder syndrome because it involves more than just the glenohumeral joint, which is the humeral is the humerus, and the gleno is the cup-like part of the shoulder blade that the arm bone fits into. Okay, so you get this adhesions and scar tissue, and you get that adhesive capsulitis involving that joint. Now, when that gets involved, there's other joints that get affected by it. You get the joint over here called the sternoclavicular joint. That'll get inflamed and sore. You get the acromioclavicular joint, also known as the AC joint out here, that gets inflamed and sore, part of not being able to lift your arm up very high. You get the subscapularis rib cage joint, really not quite a joint, but it's the muscle of the subscapularis that attaches to the rib cage, allowing for some movement of the scapula or shoulder blade as it relates to the rib cage. So remember too that for every 2 bits of motion that come from the humerus, you get 1 part of motion that comes from the scapula. So there's a lot more range of motion in the arm bone itself as it relates to the scapula and the shoulder. So that subscapularis rib cage joint also gets involved. And then really lastly, and probably the biggest part of a frozen shoulder, is the pinched nerve in your neck, which I think is probably the beginning stages of the problem in itself in the first place, unless you've had a direct injury to the shoulder where you've fallen on an outstretched arm, jamming the shoulder up, or have some kind of another injury, an auto accident where you jam the shoulder. Those are different types of injuries, and many different types of injuries that could occur to the shoulder as a direct trauma. But you always want to look to that neck. And many times when patients come in with a frozen shoulder, they got a lot of tension and tenderness in the neck. This is involved so much that they don't even know that the neck is part of the whole process, which is leading to this problem here. All right. So pinched nerve in the mid to lower neck at C5 and C6 vertebrae. So if you know somebody, or maybe you yourself, you have some frozen shoulder problems, my contact data is below, so give us a call here and we sure could help you with this problem. If you know somebody that's got a frozen shoulder, and it's easy to tell too, because they can't lift their arm very well, and many times they'll tell you that they have a lot of pain in the shoulder. So if you know that person, send them the video, send them the link to the video, tell them about us. Again, the contact data is below. And I look forward to seeing you here in the office, and I'm going to help you with your shoulder problems and your frozen shoulder. Okay? So see you in the next video.